Hi guys, and welcome to my YouTube channel. My name is Violet. For my returning subscribers, welcome back. If you are new here, welcome, and please do subscribe to my channel, like my video, and I would really appreciate it if you did comment on some of the topics that I do put on this channel. So without any further ado, let me just go straight into the video. Imagine a lifestyle of constant consumption of alcohol, clubbing, having sexual relations, unprotected sexual relations with people, and then you end up having an STI, and then fine, you do acknowledge that you have an STI and you want to go to your nearest clinic or your hospital or your general practitioner. In general, what they will do is that they're going to give you 3 antibiotics, an injection, metronidazole, and azithromycin. And for a pain, if you're experiencing any pain, I would rather recommend either paracetamol or ibuprofen, depending on the person that is treating you, right? So let's get into the drugs, right? Number 1, metronidazole. So when you take metronidazole with alcohol, mind you, if you take alcohol the previous night, you still have alcohol in your system the following morning, right? So if you take them together, it's going to cause what we call the disulfiram reaction. With this reaction, you're going to have severe vomiting, diarrhea, stomach cramps, headache, pains. Like, it's just going to be a lot because of that interaction with alcohol, right? So what I would essentially recommend is that you try to drink lots of water so that alcohol is excreted from your system before you taking any antibiotics, right? So just to prevent such reactions, because you will feel sick, right? Some people even go to an extent of vomiting their medication right after drinking it, because one thing about metronidazole is that there is no drug or there is no brand of metronidazole that is nice to take. None of them are coated. They're just as they are, and they are big pills. So sometimes you will feel it as it passing there, and you will feel the bitterness, like you will taste the bitterness, and it's not good. Anyway, so the second drug is azithromycin. So normally they'll give you like 2 tablets of azithromycin and you'll take them at once. And if you take azithromycin with alcohol, what happens is that you have similar reactions with those that of metronidazole, and they are not nice. So your vomiting and your stomach cramps and your diarrhea are the most common, but they'll be very severe. So another thing is that some patients also still vomit this medication. Remember, if you do vomit them, you need to take them again, because I mean, they're not even absorbed into your system, so it's a crisis. But otherwise, those are the 2 antibiotics. The third item that I'm going to talk about is paracetamol. Yes, your Panado, the one that you use for pain and headache, the one that you most likely use for stomach cramps and period pains, the one that you will most probably use for a hangover. Let me stop you right there. So paracetamol and alcohol are competing with each other for excretion in the body. So the liver has to break down alcohol, the liver still has to break down the paracetamol. So what happens is that the liver will be overworked. This will cause problems with your liver, either in the near future or in the long run. But I would really advise that you do not take paracetamol for hangovers. Take aspirin. Aspirin is fine. And if you're a lady and you're on your periods, aspirin might not be a good idea, because it will cause thinning of the blood and then, you know, excessive blood loss. So what I would recommend if you are on your periods, mefenamic acid. It's also painkiller that I used for my period pains. It's an over-the-counter medication. You can get it without a prescription. So just take that and then you'll be fine. Back to the topic. So yeah, these are the drugs that I wanted you guys to be aware of before you mix them with alcohol: metronidazole, azithromycin, and paracetamol. Right, so these are the commonly prescribed drugs for STIs in the healthcare system, especially the government healthcare system. So yeah, anyway, thank you so much for watching my video. That was a very short one. If you do like such videos, please comment down below so that I can create more of these. Please subscribe to my channel if you haven't subscribed. Thanks so much for watching, and I will see you next time.